highlight myself. All right. Hello, everyone. Good afternoon. If you are just coming in, if you can please put your name and your organization into the chat so we can just have a sense of who is here with us today. Thank you for joining our first webinar in a series of webinar that is hosted by the Tennessee Department of Health, Tennessee Local Food, and the UT Institute of Agriculture. We are really excited to be here, and thank you for your patience as we kind of figure out WebEx. This is the first meeting and the first time a lot of us are using WebEx. So thank you for your patience, but so far so good. We are doing this webinar series because we just see the value and the intersection in all of our work and wanted to highlight and dig a little bit deeper into more about how public health, agriculture, all intersect and impact each other. So each week, we're going to be bringing you panelists who are experts in a specific topic area, and at the end, we'll preview what the other sessions will be about. So we're really excited to be here. Caitlin, if you can share that next slide, the TDH slide, I think there you go. Yes, we are also offering continuing education credits for these series. If you get CE credits, you usually know how this works, but you do need to register and train, which everyone that's here has done. You need to attend the entire session and then complete required evaluation and train after live webinar within 30 days. We will be verifying attendance and partial credit will not be awarded. Next slide, please. And also, the views and opinions expressed in this meeting are those of the speakers and do not necessarily reflect the views, opinions, or positions of the Tennessee Department of Health. So with that, I am going to go ahead and kick it over to Natalie, who will be moderating our panel today. And I am going to, Natalie, highlight you. So just bear with me as I do that, but I will kick it over to you. Thank you.
Thanks, Paige. And thank you everyone for joining. It's really exciting to look in the chat and just to see all the organizations and folks that work at public health offices across the state. Very exciting, and thank you for taking time out of your day to join us. My name is Natalie Ashker-Sievers. I direct Tennessee Local Food. We're a 501c3 that supports farmers and local food systems across Tennessee. And I am really grateful that we have had this opportunity to partner, and thank you, Paige, for initiating this webinar series around this topic. And thank you to Kim, Dr. Morgan from UT Institute of Ag for coming on board as another partner to help bring this to life. So like Paige mentioned, over the next few months, we'll do a webinar per month, and we'll dive deeper into more nuanced topics around this intersection of agriculture, food, and public health. This first one is really intended to be an introduction. So higher level, sort of what brings us here, what is this intersection, what does it look like, how does the way that we grow food, how does that impact our community health, and how do we get there? So to kick it off, I'm going to really let our panelists do their own introductions, but I'll just start by just giving you a high-level overview. We have Dr. Ford, she has a new title. Let me just flip my page over. As the Managing Director of the Tennessee Association of County and City Health Officials. She also teaches at the University of Chattanooga and is a part of the Tennessee Public Health Association. Thank you for joining us, Dr. Ford. We have Famika Elliott, who is the co-founder of Rooted East Knoxville. She also has her own business called the Lotus Program Experience, and she does a lot of work with maternal health, and I'm excited to hear more about that. And we also have Dr. Kim Morgan, who is with the University of Tennessee Institute of Agriculture and is specifically an extension economist and associate professor of agriculture and resource economics, and is a great wealth of knowledge. So thank you all for being here. I'm going to just kick it over to our speakers. So Dr. Ford, I'm going to start with you. This will just be a chance to do a couple minutes introduction, who you are, how does your work intersect with food, agriculture, and public health, and why do you think this is important? We're going to do maybe 2 or 3 minutes per speaker. So I'll start with you, Dr. Ford.
Okay, thank you. I'm excited to be here. I'm from Kentucky, and I grew up on a farm, and my grandparents were next door, and we grew up with big gardens, growing our own food. We had livestock as well, and there's been a big shift, through my lifetime, and it has resulted in health impacts, which I'll get to a little bit later. But I've lived in Tennessee for almost 30 years. I have a PhD in public health with a focus on epidemiology. I've been in higher education for a long time. I see a lot of Department of Health friends here, especially infectious disease. I'm not going to talk about infectious diseases today, but those can be a part of growing your own food sometimes, unfortunately. I've done a lot of work with Tennessee Public Health Association on climate impacts and resiliency. And the changing climate impacts a lot of things, and the agriculture sector is one of those, which impacts our food security. One of the things Tennessee Public Health Association has been doing is working with rural counties across the state to do trainings on climate projections for Tennessee and how to be more resilient and how to be prepared. In fact, we have a Leadership Institute coming up next month where it's a train the trainer. So we train some leaders from across the state, and then they go back to their communities and talk about these climate impacts and how it will affect their lives in many ways, including food, access to healthy food. I also do work in other countries, and I just bring this up briefly because it's not just the US that is affected. I do work in the Bahamas in some rural islands where they import over 95% of their food. So it's a lot of canned food, processed food, and obesity rates, for example, in women of the Bahamas are the highest in the world, over 70%. So I've been doing some work there to start community gardens and education programs about healthy foods. And I am waiting to hear on a grant. I'm hoping to do some focus groups to work with the women there to understand some of the cultural barriers as well. So that's kind of the scope of my work right now. And I'm glad to be here and happy to stick around if there's any questions after the end.
Thank you so much. And I forgot to mention my housekeeping notes, but we'll have the other speakers do their intros. But you mentioned questions. If folks do have questions, feel free to put them in the chat. We're going to be keeping an eye on the chat, and we will make sure we've allotted 15 minutes at the end for Q&A. So we want to make sure that you have an opportunity to ask your questions. You can put them in the chat, or you can hold them till the end. Famika, we're going to jump to you. Could you share a little bit about what you do and how it connects to food and agriculture and public health?
Sure. Hello, everybody. Can y'all hear me? I was having some technical difficulties. Okay, great.
Yes.
Well, before I introduce myself, I would just like to acknowledge the land that I sit on. So I sit on the land of the Cherokee, Yuchi, Shawnee, and Creek peoples. And so they steward this land before it was called Knoxville, before it was called Tennessee. And so without further ado, my name is Famika Elliott. Community knows me as Mika or Meek. I am the executive director of the Rooted East Knoxville Collective. I'm also founder of the Lotus Program Experience. My work is at the intersections of food justice and birth justice, so maternal health and women's health. I'm also a community health worker trained through Meharry Medical Center as well. And I'm also a full spectrum doula with an emphasis on the postpartum period. So I'm a postpartum and I'm also a death doula. So Rooted East was founded in 2022 here in Knoxville as a response to the history around food apartheid, specifically in a predominantly Black historical area of Knoxville. If you don't know anything about food apartheid, which I can get into later, it is systemic, it is structural in relation to food. And so this community that I've been serving for over 10 plus years now, even prior to Rudy's, has experienced redlining, land loss, displacement, grocery divestment, and systemic divestment that has made access to hyperlocal and fresh food difficult. And it is by design. That's a part of food apartheid. So our work is about recreating the natural food landscape in this specific community. So not just by increasing the access to fresh produce, but by helping the residents grow their own food, reconnect and heal in relationship with the land, and to rebuild community control and autonomy over their own food systems. And we hope that we inspire other people in Knoxville to do the same across other communities. We do this through several ways. So we help build home gardens. We help transition our home gardeners and land stewards to community gardens and more communal growing practices. And then we also train them with land immersives and other stewardship work and opportunities that may exist within the region. So our work centers self-sufficiency, but also community and collective care, which needs to be brought back, especially in these times. So at our heart, Rooted East is about restoring the relationship between people, between the land, and between our foodways. And health and resilience go hand in hand. And so my background, again, is in social work. I was a social worker for 8 years. I have training in whole foods education, plant medicine, and also culture preservation. So all of that also informs how I approach this work. For me, food is not just about nutrition, it's relational. It's also a part of storytelling. It's a part of culture, dignity, liberation, and healing. So I'm also the co-founder of Knoxville Black Maternal Health Initiative and Conference. We've had a conference anchored here in Knoxville for about 4 years now, where we advocate for better maternal health outcomes in legislation across Tennessee, but also globally. I also serve as the co-chair of the East Tennessee Community Housing and Farmland Commons. In that role, I work to advocate for land reclamation, affordable housing, farmland access, and restoration of foodways and stewardship practices for Black communities, Indigenous communities, young farmers, first-generation farmers, and also farmers, especially our elder farmers that would love to reconnect back to the land, don't have access to any. So everything we do is rooted in the belief that food is power, that land is healing, and when communities have control and autonomy over these things, public health and true resilience actually become possible. Thank you.
I'm snapping over here. Amazing. Thank you so much, Mika, for being here and for sharing all of your experience with us. Dr. Kim, or Dr. Morgan, Dr. Kim Morgan, your turn.
Kim works fine. Yeah, and thank you guys so much for inviting me to join this group and to be part of this conversation. It's definitely important to the work that I do. So I'm an ag economist. I'm new to University of Tennessee Institute of Agriculture, but I primarily have worked in the specialty crop, fresh fruit and vegetable production. And I'm really closely related to, or we work very closely with the growers in the states that I have been a part of. So for me, it's what questions do they have and what do they need to know to better produce, to better market, to take better care of the workforce that they need to do that. And so I've done that in 4 states now: Tennessee, Mississippi, Florida, and Virginia. So I have a varied background in how I apply what I do. So for me, I don't come from a farm background. I'm 3 generations removed from a farm background. My family is all from the Midwest, and my grandfather was very proud of the fact that he did not have to work on a farm because it was just so much work and it sort of dominated his childhood. So for me, my training started with animal science. I was really interested in working with animals. Of course, that means you go to vet school. Pretty quickly figured out that because you want to work with animals means you have to work a lot more with people than I ever wanted to. So I switched to the ag econ field because I love the way economics allows us to put and help build choice sets under conditions of scarcity, income restraints, or what have you, and make better decisions based on what you know to be, your conditions and the resources to hand. So I've always loved that approach to solving problems. And I love working with students that are trying to find answers in that way as well. A lot of us hear about the economy. Very few of us know what that means, what is included in the economy. and how to make any kind of sense of it in terms of what's in the big picture versus what's happening in our own households and communities. So yeah, a little background about me, and of course, I'm always open for questions if there's more.
Thank you so much.
Sure.
Before we jump into kind of our first question, I forgot to mention this housekeeping note. We are recording this and we do intend to share it. So if you do not want to have your face shared in a video format on the internet, feel free to turn your video camera off. And if you could keep yourself on mute at the end. If you're just joining us, just a reminder, we will have 15 minutes at the end for Q&A, so you can hold your questions till the end, or you can add them in the chat. Also, if you're just joining, please be sure to add your name and your affiliation in the chat so we can keep track of who all's here. So as we dive in, I think that many of us that work in this space, it's very clear that the health of our soil impacts the nutrient density, or the nutrient rich, how nutrient dense our food is, and that impacts our human health and our community health. So that's kind of the thread, right? The soil health, and then the food, and then the humans and the community at large. But as an introduction, want to take just a moment to hear from any of our panelists. And I know, Kim, that you might like to speak to this about how our natural resources, the way that we preserve our natural resources, why is that important, and how does that, can you just kind of pull that thread from the soil to the community? It's kind of like a big picture for anyone that's maybe has never really thought much about agriculture or farming, and how we get to that community health piece.
Oh, I'm sure I'll do my best. That's a big one, but I'll do the best I can. So, as an economist, we have three resources. We have land, which includes water, we have labor, and then we have capital, which is usually equipment or some type of technology. So, very simple way of tackling a really big question. But when it comes to soil health, when it comes to water quality, there's no question that globally we're struggling in that area, especially in the US, where we've become very, very efficient at growing crops, whether it's fruit and vegetables or tree crops or corn and soybeans, or even our cattle and livestock and animal production. We're very efficient. We get very high yields per square foot of land used, or amount of feed fed to animals. But at the same time, we've got this kind of pending problem. If the growers I've worked with, whether they're in South Florida and the Everglades, which is basically like living on a sponge, or they're in the Midwest right along the Mississippi River, which are historically very fertile grounds, they're all concerned about the health of the soil, given the yields and productivity gains we've been able to make. So everyone that I've worked with on the production side is very concerned about that. So when you look at the quality and nutrition quality of our fruits and vegetables, or any of our foodstuffs, and I'll leave this more for Dr. Ford's area, but from my understanding, we have done really good growing things to live on a shelf and to be stored and shipped. We're very good at that. We have, in that process, lost a lot of the nutrient quality of a fresh fruit or vegetable that you're going to grow in your backyard. So how are we going to push nutrient value in every single piece of fruit and vegetable we eat? Or in my case, try to get my kids to eat? It's difficult. That's a big question when the food just doesn't taste that good. And those of us that have some gray hairs remember when it did taste good, or those of us that have the ability to garden in the backyard, there's a completely different taste to that, as well as the nutrient quality. So this is something that every grower I've worked with, regardless of scale or scope or size or how long they've been in the business, is acutely aware of, and are really searching for answers for, okay, what do we do? How do we do better? Especially given the climate changes that they're all observing, and how that temperature, hurricanes, floods have an impact on that going forward. So it's a big question, and it rattles all the way through up to what we eat and how we engage with the industry.
Yes, thank you for answering that really big question. Mika, I threw this question in at the beginning. Is there anything that you want to add to that, or no pressure if not, but just...
Can you repeat the original question?
Yeah, the question is just sort of for folks in the room that aren't really familiar with, don't think much about farming or agriculture. How does the way that we grow food, and like the way that we treat the soil and the land, how does that trickle back to the health outcomes in our communities?
Oh, it matters 110%. So the community that I serve, and we've seen this in real time over the past 5 years since we've been involved in community, specifically for Rooted East. You know, the median income level is at or less than $18,000 a year annually for Black residents in this area, but also chronic hypertension, diabetes, high blood pressure, like heart health is like one of those that's just it was just heartening to hear about the health conditions, right? But also you have to look at the living conditions and what has also caused those things, outside of just like not having access to fresh foods or not having access to land to grow your own food. Our grocery stores were shut down, closed, removed from the community. And that's one way to disarm a community, especially a thriving community as well. And so, what happens when you remove, the things that a community needs to thrive? Health is going to be one of the number one things that's going to be the first to go. And so what we've seen when folks have gotten back to the land and gotten their hands in the soil, health conditions have also improved. Mental health conditions specifically, yes, heart health as well, since they have been growing their own food and stewarding, their own gardens, but also within the same breath, probably about 75% of our home garden participants don't actually have the opportunity to actually grow in ground at their home. And we have to, we're kind of forced to actually do raised bed gardening, and so we have to expend money for soil and compost and lumber and all these things. People are like, well, why don't you do it in ground? Why don't you test all these, get a soil test? I'm like, well, it's simple, but it also becomes complicated, because once you start to read all these tests about how much lead is in the original soil and all these things, but also know the history of East Knoxville, most of those homes and where the people have been displaced, those homes were caved into the ground and then topsoil was covered on top. And so we don't ever want to continuously do harm to the community that we're trying to serve. Again, that's another reason why we exist, because of the harm that was done. So we're trying to undo something that was done to the specific community. So it does matter. And I think that regardless whether you are a grower or not, you should take your best interest in asking these tough questions, especially how your food is grown and where it comes from, because it absolutely does matter.
Thank you. So, Dr. Ford, I want to turn to you. You mentioned in your introduction about your work in the Bahamas, and you mentioned all the food that is shipped in. So I want to talk about local food systems and what does a local food system even mean, and how could local food systems improve health outcomes both for rural and urban communities?
Yeah, I'd like to first talk about the health outcomes, focusing on chronic disease, because that's what's connected to nutrition. Tennessee residents suffer from a lot of chronic disease. 60% of us have at least one chronic disease, and 16% have 3 or more. And the leading causes of death in Tennessee are from chronic disease. So we're talking about, or condition like obesity, diabetes, heart disease, all of those things. And so diets with poor nutrition are tied to those types of chronic diseases. And the health outcomes are worse in rural counties compared to urban areas in general. And that's why there's a lot of focus right now on improving healthcare access in rural counties of Tennessee. The Tennessee Department of Health just got some money from the federal government, is going to be able to provide millions of dollars in grants across the state to improve health. But at the local level, food systems can result in improved access to healthy and nutritious food that's affordable. I was thinking about survey that Chattanooga just did of residents, and they asked, are you food insecure, and then asked why. And I thought the top reason would be because of access, like they didn't have a grocery store nearby. But the number one reason was cost, which makes a lot of sense right now. Especially fresh fruits and vegetables are incredibly expensive, so that's really impacting our health. I wanted to talk about one specific example, and it relates to lead in soil that we were just talking about, because we have a huge problem in Chattanooga. We have a EPA Superfund site, which means that the lead is so bad that the EPA has intervened and is spending millions of dollars to clean it up. And it is in soil of 8 neighborhoods on the south side of Chattanooga. And it was discovered when a couple was doing gardening in their backyard, and they became lead poisoned and ended up in the hospital. So that was about 15 years ago. We pulled in the state. We didn't know what was happening, and found out that there is foundry sand throughout those neighborhoods that was the byproduct of some foundries way back in the day. We're in an industrial city. So since then, there have been a lot of initiatives to clean up the soil, but raised gardens are absolutely necessary even after the cleanup is done. That's something that we recommend. And a place in one of these neighborhoods is called the Bethlehem Center. It's a community center. And in 2020, they started a garden. Well, now they call it the farm. It's only 1/4 of an acre, but they produce, and it's mostly through one full-time employee and a lot of volunteers. They produce thousands of pounds of fresh produce that they give away. So people that live in Alton Park, and it's a very densely housed area, they can just walk over and pick up produce from the garden, and it's all year round. It includes winter produce as well. So that's one example of a nonprofit organization being engaged in the community and providing access to fresh fruits and vegetables. But also mobile markets is an example. The health department has done that here in Chattanooga. They also have grants to schools to start teaching gardens. So involving community organizations, schools, even healthcare systems in buying local produce and making it available to the community. Those are all examples of local food systems that can improve health.
Thank you. Does anyone want to add anything to that?
Yes, I'll add. So I believe that local food systems improve public health because they should be addressing the root causes of chronic disease, not just the symptoms, and placing band-aids on things. So specifically in East Knoxville, our community members don't lack the knowledge about like what healthy food is. It's like what we've lacked is access. So access to um substantial, affordable produce, right? And so that lack of access, but also access to land, right, to grow our own, was created intentionally through, like I said, the redlining, the highway displacement, the grocery divestment, and land loss, that has contributed to food apartheid. 2 or 3 notches up from what a food desert is. So I think in like these webinars and like other spaces, we hear the term food desert a lot, but like we're naming it what it looks like in our community is food apartheid, which encompasses the methodology around food desert, but also a desert to our community is insinuating that nothing is there, and that's not true. And so when food is grown, distributed, and owned locally, we believe that people have consistent access to fresh food. That's what it looks like with zero barriers. Dollars circulate and are kept within that community. Land becomes a site of not just growing, but healing instead of extraction. And we're not here to utilize the land. We're here to be in relationship with it. And I think that's what separates like different like land stewards and people in ag, because you know how our community has been in a relationship with land is totally different. And youth and elders should be reconnecting and also sharing food knowledge. So I saw somebody in the chat that was asking about like, you know, are we going to be talking about like food literacy? Those are the things that we talk about in our community-led agriculture program at Rooted East is food literacy. And so we also have elders that have also done this work, older generational farmers who have done this work, and that always bring back that knowledge to teaching the community, but to also stewarding our young people, because we believe that the youth is also going to be able to carry this vision through, as we readopt these ways of how the community has cared for themselves through agriculture. And also transportation and cost barriers should and are be reduced. So you cannot like prescribe vegetables to somebody who has nowhere to buy them. You can't come into a community and say, oh, you should probably be eating Swiss chard when the culturally relevant vegetable is the collard green or the turnip green or the callaloo. And so when we talk about food literacy too, we're doing all of that and talking about culture and what does it look like across different culture. And lastly, local food systems should have the ability to make the healthiest choice, but also the easiest and the most accessible healthiest choice for them. I feel like that's where like real public health begins, outside of like academia and research, right? So we have a lot of institutions that love our organization that want to come and do research, but we also have to talk about, you know, the methodology around research. Where is this going? Is, you know, is our community going to be able to share these results? Are we going to be able to utilize, you know, your findings to go for grant funding to bring back to our community? Are you going to do a white paper in our community and be extractive, and we're not ever going to hear from you, but your land grant gets trillions of dollars? Like, what does that look like? And how can we co-create this together? But also, how can everybody be involved and take an active interest in like this new food ecosystem that we're building here?
Wonderful. Thank you. So my next question, Famika just mentioned many of the barriers, but I want to, I know we want to talk about sort of the solutions, but let's make sure we're all kind of on the same page about the barriers that small and mid-sized farmers are facing and why it is such a challenge to get local healthy foods to community. And I want to start with you, Kim. And I'm wondering if you could answer that question however you'd like, but I'd also like to throw in an extra question for you, which is a question that I get all the time. And I have my own answer, but I want to hear your answer because you're really the economist. Why is local food more expensive? So I can, let me repeat my first one so you know, but biggest barriers facing
Okay.
small and mid-tier farmers, and you could talk about the economics. I'm sure you'll go there, but
Sure. No, and that's a great question because I didn't mention at the beginning, but my roles have always been extension heavy. So what research I do is stuff that I was asked to do by my growers or from the consumers that I've worked with and done focus groups with. So one of the biggest problems with that scale, what you're talking about is a question of scale. So you have X amount of feet or acres to produce on. How do you get the most out of that to make the most amount of money? So we can have, I work a lot with small growers that sell at community markets. If you've been to a community market, you can see they have a lot of stuff. They have a lot of produce in a farmer's market. And my question is, where does it go at the end of the day? And there's, sometimes they sell out, sometimes they don't, but that, knowing the market and knowing how much they're going to take and then matching that up with when the crops decide to produce their yields. So in fruits and vegetables, you have an incredible amount of yield in a 4 to 6 week window. It's very, very time consuming to harvest fresh fruits and vegetables. And you have a lot of food safety regulations around that, for just harvesting it, packaging it, transporting it, selling it in a farmer's market when maybe 90 degrees that day. So those are kind of two of the things. It's like they have, how do you get a consistent supply to your buyers? You know, we're all used to having fruits and vegetables of all kinds every day, all year long, no matter where we live. It's on the shelves, but how do you as a grower, you know, either sort of lengthen your season so you can produce it, you know, when times when there's not as much available in the markets you're selling to? And then how do you move all the product that you do have? And you're selling largely to audiences like those of us homeowners, household consumers. We know how to eat fresh-ish. We're still 50% of us are eating or more eating away from home on a regular basis. So a lot of that is lost. Like, how do you preserve food? How do you store it? How long is it supposed to last on the shelf? And this is another thing with sort of locally grown sourced food. You're buying stuff that isn't grown to sit on a shelf. But if you're used to iceberg lasting 2 weeks in the fridge, and then you buy $5 a bunch romaine and it dies 2 days later, and you're like, wait a minute, I just spent all this money. So there's a lot of education component to that. And then how do you pickle it? How do you can it? I mean, how do you understand that you're not going to have apples year round? You're not going to have lettuces year round. So you have to kind of eat seasonally, which is very foreign to a lot of us. That's not how we're used to seeing things. Um, so yeah, and then how the grower on the grower side, how they're going to move that volume. So when I work with growers that want to scale up, then we're starting to look at, okay, we need to sell through restaurants. Well, restaurants want the best quality. They don't want your seconds. They don't want what you didn't sell at the market 2 days before. If you're talking about, meat products, you got to definitely be concerned with a lot of regulations and how they're harvested and how they're transported. And the fact that most of the animal is going to end up in a ground form or a sausage, not filet mignons and expensive cuts like that. So the grower still has to move all of those pounds of meats to whoever's going to buy it. So that's different markets. So they're having to deal with not just producing, but marketing. And that's not something most of our growers know, any scale. They're familiar with selling through brokers. And they don't even deal with the sales team a whole lot. Most of my large growers of produce in South Florida sell through brokers. And you ask them, well, how do you know when to harvest? They're like, I don't know. And I'm like, well, when do you do it? Well, when the yield is this and the weather is this and we have the workers. And I'm like, okay, well, what's the market price? I don't know. That's our sales team. Whereas in my side, with working with small and mid-sized growers, the markets drive everything: what you grow, how you grow it, how you sell it, can you pre-sell it? So you share some of that risk, with your actual consumers, your end buyers. So there's a couple of things going on, like both sides of the equation, right? Like consumers don't understand how to handle fresh stuff, or the fact that those costs go up when they grow less scale, and then our growers don't understand how to market it.
Absolutely. Thank you. Would anybody like to add to that? I'm thinking about land, and I'm thinking about land as I'm sure, yeah, maybe that's where you're going to go for me. Just for everyone's reference, like land is the number one barrier for next generation farmers. Think about younger people that want to get into farming, don't come from a family with generational land to pass on. Mika, do you want to share about what you all are working on in Knoxville?
Sure. So, yeah, outside the structural barriers, which I name out of this, but agricultural barriers, access for those who have historically been barred from having access. So I'm talking about your Black and Indigenous farmers, even our rural Caucasian farmers, which are half of my comrades. They don't have spaces to start their agricultural journey, their farming operations. And they're working their way like inner city where we're at. We're growing food on concrete. We're growing food at churches. We're growing food in the back of people's houses, on the porch. We're doing aquaponics, like just everything to get food out to people and make it accessible. But when we found out a few years ago that Tennessee was losing about 2,000 acres a day, I have no idea what it is now. I'm sure it's drastically higher than that. Access to land, especially folks my age or even younger, are looking to start their agricultural careers, especially those who are first generation or those that want to reactivate and get back to the land. God is not making any more land. And it doesn't just fall out the sky. It is very expensive. And so we're looking into more innovative models, but also bringing back what communal growing looks like in community and teaching other communities how to do community, right? It takes a lot of personality definition, like working together, setting differences aside. And so we are working with the Farmland Trust, the Farmland Commons. We call ourselves East Tennessee Housing and Farmland Commons. And so this model sits as a 501c25, where 3 or more nonprofit organizations and affinity groups, community-based organizations come together to steward land together. And anybody a part of those organizations and or a part of those respective communities can come together on several parcels of land that creates this container for kind of like a land bank. But it's not, it's agriculture forward, but it's not, the priority is not like conservation-esque, if that makes sense. So how a lot of elder farmers, because their heirs don't want to take over their farm and or they don't want to sell to the highest bidder, they're putting them in conservation easements. However, that is not sustainable for people that need to eat and need to eat well. We understand what conservation is and we respect. However, this model allows this and that and this and that, so we can put infrastructure on the land or these parcels that come into the farmland commons. We can steward the land. We can use it as a retreat space. We can build up on it. We can conserve and put some of it in an easement if we would like. It can be city parcels. It can be undeveloped rural land. It can be an old farm that's put in. It could be a house. It could be a housing development that's properly owned. And so this mixed model just works very well for our community, but also I feel like our community is a specific community in Knoxville that actually just gets what communal growing actually is. Like, we respect the art of community gardens, but we want to go back to how community gardens originally operated. And that's not one person just is going to steward one bed. It's all of us is stewarding these beds and or this land together, being in relationship with one another. And so, we figured out that, we love this model, and this model specifically, is great for people who have land that's not on the market and that does not want to put it on the market. And so our friends and family at the Farmland Trust and Commons, they actually, entertain these conversations and bridge these gaps between up and coming land stewards, generational farmers, ag-centered community-based organizations, and partner them up with generational growers and people that own farms that are looking to keep their land in agriculture and or community. And so that's what we're doing here. But back to the barriers, I'm going to list mine real quick. So small farms can grow food, but our small gardens that we have in community, distribution infrastructure, cold storage and aggregation is a big one. We are growing tons of food, believe it or not, in people's backyards. Most of our home gardeners have 3 and 4 beds. They have like little mini farms in their homes. And so even though we're growing a lot, it's number one, it's never going to be enough. Number two, when we do have an abundance, especially in the summertime and hit that peak like abundance season where we're processing and overproducing, like, we don't want that stuff to wilt. And so cold storage is like the number one. And so yes, we have some community fridges in the city, but it's not enough. We need a cold storage and a food hub. And so that's something that we're working on. We are also working to be in relationship with one of our elder farmers that's building a community-owned grocery store called the 1-5 that's going to specifically sit in a 37915 zip code where our community is, to also funnel in the produce that's being grown amongst our home growers and also our other farmers into this grocery store so that folks can have access to it below market value. And then fair pricing. Also, institutional buyers willing to purchase local food, and then policy that actually supports food crops over commodity crops and small growers, right? And I'm talking about growers that grow and farm under 1/10 of an acre. And so at the same time, SNAP and WIC and schools and hospitals are rarely set up to actually purchase directly from these local growers without layers of the bureaucracy. And so we do have farmers that can grow food and communities who need food in a system that's designed to keep them apart, right? But also, like I said, we need food hubs, we need cooperative distribution, we need procurement changes, that make buying from a local farmer as easy as buying from a national distributor.
Thank you. So our barriers and our challenges are like so many. But there's also opportunity, and hearing about the Farmland Commons model that is being built is inspiring. And it's an innovation that is bringing together many partners. And so, because of time, I'm going to summarize my last couple questions into one question, and I'll give, I know maybe Dr. Ford, I'd like to hear from you on this one, especially. Can you share about any, and again, this is my final question, and then we're going to open it up for community questions, anybody that wants to add. Dr. Ford, can you add or share about any innovations, partnerships, things that are happening that could effectively improve public health, stories of success as it relates to innovations or partnerships?
Yeah, and we had a wicked storm just it just moved through, which I'm not complaining about because we need the rain. So I left for a little while, but I'm back. I've been thinking we've touched on a lot of things, and a lot of my notes we've already covered. I had a couple of thoughts. There's this concept of food forests that I don't think we've touched on yet, but there are some here in Chattanooga, and that's where you have a small area of space, but you have several layers of crops, so you can grow more on a smaller plot of land. And my son is actually in college, and he's helping build as a summer internship, a food forest. So that might be something to look into. So you have fruit trees, and you have shrubs, and you have herbaceous things. So because land is not available to everybody, I think we need to think, what can we put in a small, piece of property, and also the hydroponics that was mentioned. And then I know that universities have a lot of resources. They often have a lot of land too, and they're always buying additional land. So we have some gardens on the University of Tennessee Chattanooga's campus, and they donate. Not only are they training students how to raise crops, but they're also donating produce to the local food bank. And they're allowing community members to, and they don't have to pay, to reserve plots on campus so that they can grow their own food and also receive some, training and help from the faculty on the campus. So those are a few ideas.
That's great. Kim, would you like to add anything to that question?
Sure. And when it comes to partnerships, I think Amika touched on a lot of what I sort of had in mind. But I saw somebody did an assessment how long it takes to deal with fresh foods and vegetables and handle trying to store them or can them or even source them, the time it takes. And it said it takes about 10 hours a week to do so. And I'm like, no wonder I can't pull that off. As an ag economist and someone who's really invested in this idea, it's really difficult. But the thing also, as an economist, that I would add to that is that investment now by one person can be shared in the future in terms of gains all the way around to household health, to the community health. And that's a measurable gain that's not talked about a lot. A lot of it's just like right now, right here, one person, but that one person's time is an investment across the entire household and community, and can result in positive health outcomes as well. And also sharing knowledge, how you do that, trying to relearn some of those skills that others may have thought, hey, I never want to do this again. I'm sure my grandmother never wanted to can another thing in her life. So, and we've seen that in the big market. I mean, canned food, Del Monte's gone out of business. People aren't into canned foods. So I think partnering, like you said, and then understanding the economic benefits extend well beyond that time investment up front.
Absolutely. So because of the time, I would love to open it up to everyone here on this call. If you have a question, it's going to just be popcorn style. You can come off mute, ask your question, or you can drop it in the chat and we'll read it. Before you ask questions though, I do want you to know that over the next few months, some of the topics that we're going to do more deep dives into include soil health, mental health, climate resilience, and community food access. So we are going to dive deeper. This was really intended to be an overview, a big picture sort of introduction into this intersection. So And also we have all of the links to register for those future webinars are in the chat. So you can register, but go ahead. Would anybody have a question? If y'all don't have questions, I have more questions. I did notice one question in the chat about food literacy, and I think Mika spoke to this a little bit. Would anybody else on the, I'll read this question. Do you all plan to discuss food literacy as well with this series? That's, I guess, more for us as organizers. Yeah, that will come into play more in our community food access session, which will be on September 16th.
Natalie, I guess I have a question.
Yes.
You guys talked a little bit about bringing kind of like the younger generation in for farming, but what's something that can help, I guess, increase that, getting young people interested in farming, kind of starting these small farms? And you did talk a little bit about this throughout your answers of the different questions, but how can we incentivize or encourage young people to get involved with agriculture?
I can jump in on that one since I work directly with students that are involved in my extension programs. And by that, I mean, I take them around the farms and I say, find problems, y'all figure out how to fix it. So a lot of it is we have a lot of people interested in food and food systems, but we tend to be kind of a closed community in agriculture. Myself coming from outside of it, 3 generations removed, no 4-H, no FFA. It can be a very insular community and hard to sort of get into. So I think one of those ways to get kids involved is to let them jump right in wherever they're at, so they can try to have fun with it. I mean, we could touch on this a little bit, but there are so many psychological issues around the idea of food, whether it's eating too much, what you eat, where you get it. It becomes it's not just about substance to get you from here to there. So I think making it more fun and taking away some of the, and this may be more Dr. Ford's idea, but some of the negative messaging that's around it. Well, don't eat this, or this is toxic, or this is better. Take some of that away and play with it and have fun with it and listen to your body. What makes you feel good when you eat a certain thing besides a donut? Because we all know there's a crash. But so like, I think that would be really helpful with the younger generation as they come up. Make it more open, make it less negative, and a lot of fun. Make it a lot of fun.
Yeah, I can speak to this because I run a
Anybody
summer
else want to
camp.
add to that?
Oh, can you hear me? Oh, okay.
Yes.
I run a summer camp for kids, and some of them don't know where their food comes from. I mean, so we need to start from the basics here, that we do grow this food. It comes from the ground. It's from plants. Here's the parts of the plant and things like that. So I think there's a lot of room for us to communicate to kids about where food really comes from. It's not just cans on a grocery shelf. And I think that will help. And one example I was thinking of was the strawberries, how delicious they are this time of year. And you just can't eat enough of them. So that's a good time to introduce a fruit to kids, and then they'll see how good it can taste during the season, and can encourage that type of behavior.
Yes, super important. I also saw Dr. Ford put in the chat a link to Crabtree Farms, and they have a great program, farmer training program. I just want to throw my 2 cents in there. I think that the reality of being a farmer is you might be signing up for a life under the poverty line. Like, that's the reality. And so that's not fun, right? People that are my age that are raising young children, it's really, really hard to make a living farming and raise your family. or even just yourself for that matter. So I think that we have to I think that that farmers need more support systems, and we have to show up, and we have to understand that the food at the grocery store is heavily subsidized, and that that's not the real cost of that food. And the price that's on that food at the farmer's market is what it actually took to produce it, right? They're not trying to get a little extra money from you. They are probably barely making ends meet. I think that land is a huge one, and it's not just saying sure you can grow some stuff on my land. Those farmers, they need to know that they have long-term access to it, that they can gain some equity in it, and the money and the time and the labor and the sweat equity and what they build up, because they're building up that soil bank, right? So I think that there actually are a lot of amazing opportunities, and there's amazing things happening all over the country, and great models that we can replicate. And I think that, Rooted East is a great model of inspiring things happening. I think Crabtree Farms, Dr. Ford mentioned, they're doing amazing things. There's lots of great things that we can look to. I see that we're coming to the end of our time. Is there any kind of final question, a burning question anybody has that we didn't get to? Okay. Well, I am just so grateful for this opportunity to have you all together. I think this is such an interesting topic, and I know that this was a really big picture view. But like I said, this is sort of our intro, and we'll do some deeper dives in the coming months. Um, thank you for being here. Thank you, everyone, for taking time out of your day. Paige, I'm going to turn it back to you for any final words that you'd like to share before we close out.
No, we are at time. Thank you, Natalie, for moderating. Thank you to our panelists, and thank you to everyone who attended today. I will be sending a follow-up email with these links for the other sessions, so you can join. That's also all on Train. And with the permission of the panelists, I'll also include their email addresses if you have any follow-up questions or want to get in touch with them. And the recording will be available on Train soon, but that's it for today. Thank you so much. Really hope to see you guys at our future sessions. So thank you, everyone.
Thank you.